Hi everyone, I am Dr Muruli Krishna, Professor and Head of Vascular Surgery Department at Sri Jayadeva Institute of Cardiovascular Sciences. So March being the DVT Awareness Month, I want to share a few insights on deep vein thrombosis for the common public. So there are two types of blood vessels in the body, one which supplies to different parts of the body from the heart, that is called arteries, and after supplying the blood vessels which takes the blood back into the lungs for purification are called veins. Any blockage in the veins from the clot is called as deep vein thrombosis. So the deep vein thrombosis is more common in the lower limbs. It can also happen in upper limbs and neck veins and veins in the brain or veins in the intestine, veins of the intestine. So why this is important is if not treated on time and properly, it can cause potential threat to the limb and life. So the clot which is formed in the deep vein can extend and can get dislodged and goes to the lungs and heart and can cause severe breathing difficulty and also can potentially threat to one's life. That's why the prompt diagnosis and treatment is important. So when do you suspect deep vein thrombosis? Anyone who is having the lower limb swelling, especially if one lower limb is swollen, unless proved otherwise, it is called as deep vein thrombosis. So what are the other causes of deep vein thrombosis? The most commonly we encounter deep vein thrombosis in patients undergoing orthopedic surgeries or any major abdominal or pelvic surgeries which necessitates bed rest for about 2 to 4 days post procedure. They are more prone. Even the people who have suffered major road traffic accidents or a neurosurgery or a spine surgery which resulting in the immobile status for a long time are more prone for the deep vein thrombosis. In some of the patients, deep vein thrombosis can be in presentation. So in about 18 to 20% of the time, we diagnose the underlying cancer. That may be the main cause for the deep vein thrombosis. Severe dehydration, and some people can have inherited procoagulant factors. So that we call hypercoagulable states. It can run in the families. Like for example, if the patient's families have less than 50 years, heart attack, stroke and all, they are all indirect evidence of hypercoagulable states. So once it is, do we need to worry about deep vein thrombosis? I will say definitely no, because this is something where we have treatment. It can get cured by over a period of 3 months to 2 years with a prompt diagnosis and treatment. So what is the treatment? Is heparin or a low molecular weight heparin, warfarin, or newer and oral anticoagulants like rivaroxaban, dabigatran and all are there. So you have to take these blood thinners regularly under a monitored specialist care of a vascular surgeon and take them regularly for a period of 3 months to 2 years, and it will get resolved in that time. Another important aspect of treatment is stockings. So compression stockings will prevent the post-thrombotic sequelae. So these two are very important aspects. And other how to prevent this DVT is, especially when one is doing a long flight journey, so one has to hydrate themselves and move your ankles frequently, and regular and healthy lifestyle will cause significant reduction in the risk of developing deep vein thrombosis. Thank you.